arises from the circumflex artery, in which case they're left dominant. In the case of this model, you can see both arteries run in equal length, so this would be a case of codominance. So there's an equal supply from the right and the left coronary arteries to the posterior surface of the heart. So just to quickly go over those that again, you've got two arteries which branch off from the base of the aorta, arising from the aortic sinuses. So you've got the right aortic sinus giving rise to the right coronary artery, and the left aortic sinus giving rise to the left coronary artery. So the right coronary artery winds around along the coronary sulcus, giving off two branches: the right marginal branch and the posterior interventricular artery, which runs down the posterior interventricular sulcus. So the right coronary artery supplies the right atrium and the right ventricle, and it supplies both the sinoatrial node and the atrioventricular node in most people, but remember there is a certain degree of anatomical variation. So the left coronary artery gives off a few branches. So you've got this first branch which runs down the anterior interventricular sulcus and is known as the anterior interventricular artery, also known as the anterior descending artery, the left anterior descending artery. And then you've got this branch, the circumflex branch, which winds round all the way to the posterior surface of the heart. And the circumflex artery gives rise to this artery, the left marginal branch, which sits on the left margin of the heart, hence the name. And in some people, the circumflex artery actually gives rise to the posterior interventricular artery, in which case the person is known as left dominant. So a person's coronary artery dominance is determined by which artery supplies the posterior interventricular artery. So if it's the left coronary artery as a branch of the circumflex, then they're left dominant. If it's the right coronary artery, then they're right dominant. So that's the arterial supply to the heart. And next I'm going to be talking about the venous drainage of the heart. Okay, so the venous drainage of the heart is by several cardiac veins which drain into the coronary sinus, which lies on the posterior aspect of the heart, on the inferior surface, so this diaphragmatic surface. And you've got this coronary sinus which lies between the left and the right ventricle, the left atrium and the left ventricle. So it lies in the coronary sulcus between the left atrium and ventricle. And the coronary sinus drains blood back into the right side of the heart. So just like all the other deoxygenated blood, it returns blood to the right atrium. So this is the coronary sinus here, and it receives four tributaries. So you've got the great cardiac vein, which runs down the anterior interventricular sulcus and drains, so it winds around to join the coronary sulcus at the back. So that's the great cardiac vein. So it runs down the anterior interventricular surface, winds round and drains into the coronary sinus. You've got this vein which runs down the posterior interventricular sulcus, and this is called the middle cardiac vein, and this drains into the coronary sinus. This one on the margin of the heart is the posterior cardiac vein, and it meets the great cardiac vein to drain into the coronary sinus. So just rotating it around, you can see it lies on the left margin of the heart, and it drains into the coronary sinus. So this is the posterior cardiac vein. And then on the right side of the heart, you've got the small cardiac vein. So this thin little vein here running in the coronary sulcus is called the small cardiac vein, and that runs between the right atrium and the right ventricle. And you've got this little branch which comes off the small cardiac vein, so this is the right marginal vein, and this drains into the small cardiac vein, which drains into the coronary sinus, which drains blood into the right atrium. So you've got the coronary sinus, which has 4 tributaries. You've got the great cardiac vein running in the anterior interventricular sulcus. You've got the posterior cardiac vein, which runs on the left margin of the heart, which joins the great cardiac vein and drains into the coronary sinus. And then you've got the middle cardiac vein, which runs right down the middle of the back of the heart, the diaphragmatic surface of the heart, in the posterior interventricular sulcus. And you've got the small cardiac vein, which drains into the coronary sinus. So 4 tributaries which drain into the coronary sinus. And then you've got these other 2 veins which you need to know. So the right marginal vein, which drains into the small cardiac vein. And you've got these veins here, which are anterior veins, and these drain the anterior portion of the right ventricle. So that's the venous drainage of the heart.